I want to encourage people to hold on to hope.
Welcome to day 4 of 15 days of mental health. I am Krisnan Hurdle of Insight Consulting, clinical psychologist and certified life coach. And I'm so pleased to have with me today Esther Trotman. She is a frontline medical doctor who's been working with patients during the COVID pandemic. And of course, we must commend and support to the fullest extent all our frontline workers, doctors, nurses, police, and all other staff working on the front line. They go through so much mentally, emotionally, putting their lives on the line, putting their families on the line, and they really deserve all of the support that they can get. And thank you for sharing with us today, Esther.
What are you seeing on the ground? And in fact, what do you think people need to know from what you're observing, from what's going on in your work experience?
Okay. So right now, we all know that there is community spread, and this virus is an invisible enemy, and we don't really know how or when the infection is traveling. But we do know that in terms of closeness with persons, we know that it's a respiratory disease and that it spreads that way. So it is getting very rampant. I say all of that to say, right now we know that community is important. We know that it's hard for us as Bajans to physical social distance, because it's so easy for us to just go online with a family member or a friend. But what we really want is that persons be mindful of the fact that we have to be very careful in these times. Notwithstanding that, we know that it's important for us to not neglect our mental health. So, coming from the perspective of a medical doctor, I know that the struggle with isolation is real, and it triggers and it causes struggles with depression. And then anxiety is another thing that we're battling with, because there's a lot of anxiety, wondering if you're going to pick up the virus, or if you're going to make your family members sick, or if you're going to be the cause of one of your family members' death. Like, these are things that we're all faced with right now. It basically places us in a position to have to be more mindful about what we're thinking about, to be more mindful about where we're at, and actually checking in with how you're feeling. Because if you don't, and you're just going, it actually, you can find yourself at a place where you're burnt out, where you're in a very deep place of depression and anxiety, and you're not able to function
Until it's too late.
Exactly. And I feel like I'm seeing a lot of that right now. And people, and within our profession, nurses, doctors, a lot of frontline workers, we are tired. We are so tired, and we are exhausted, we're burnt out, and many times we neglect our own mental health and our own physical health. And what I've seen is that when you neglect your physical health, it also affects your mental health. And then when you neglect your mental health, it also affects your physical health. And there's that connection, and then it also spirals into your relationships, your emotional and social health. And so that connection is really present. I would like to call myself a holistic health and wellness advocate, because that really means that all areas of our wellness tie into each other, and they affect each area. And so I want to encourage persons to take stock of where they're at each day, meaning, how am I coping? How am I doing today mentally? And actually process and take that time to be mindful about how you're feeling, and then how you're feeling, because physically you might be feeling palpitations, or you might be feeling like you're getting this tension headache or you're feeling more exhausted than usual, that could be a trigger for the fact that you might be struggling mentally. And so I believe that during this time we have to be a lot more self-aware, and that doesn't just go in terms of taking care of our own health and wellness, but others, our loved ones, and also in terms of preventing the spread of this disease. So I believe that self-awareness is really important for us right now during this time. It is hard, it is really hard having to isolate yourself from your friends and your loved ones. It's been really hard this past year and a half, well, we're going into a year now, missing out on friends and family members, weddings, milestones. Like, it's really hard. But when you look at other countries that are doing well now, I think New Zealand, China, like they're going back to normal because they were following the protocols and they were aware and making conscious decisions to protect each other. And I think that we need to practice more self-awareness right now in this time, and to be to see the end game, and while we're working towards that end game, not neglecting our overall wellness, basically. Hi everyone, thank you for listening to this conversation. I'm Esther Trotman. I'm a medical doctor and a holistic health and wellness advocate, here to encourage you in your health and wellness journey: physical, mental, social, financial, and spiritual health. And you can follow me on Instagram and Facebook at star.wellnesslifestyle. The services that I provide are health and wellness seminars, wellness consultations, as well as hopefully in the future health and wellness fairs when we get back out to outside. But thank you so much for listening. All the best and keep healthy.